Good evening, everyone. This is Pam Stockton from the Cornwall Public Library. I am glad to see all of y'all here this evening. Thank you for joining us for this seminar from Montefiore St. Luke's on caring for your heart. This will be presented by Dr. Neil Khanna. But before we get started this evening, I want to lay out a few ground rules. Everyone will be muted until the end of the presentation. At the end, you can unmute yourself and ask Dr. Khanna a question. You can always utilize the chat feature throughout the seminar. We'll get started here in just a moment, and I'll give a brief introduction of Dr. Khanna. Dr. Khanna is a Crystal Run healthcare interventional cardiologist. He is the medical director of the Cardiovascular Institute at Montefiore St. Luke's, Cornwall. He is also board certified in cardiovascular disease, interventional cardiology, echocardiography, internal medicine, nuclear cardiology, and vascular imaging. So with that, Dr. Khanna, it's all yours.
Okay, thank you. And thank you to everybody who is joining us today. This will be a relatively general talk about some sort of take-home points about caring for your heart and preventing some heart issues. Some of it is sort of meant to be interactive, but of course, in the time that we're living in, it's not as much. So you can sort of answer to yourself at home in some questions that we have, but I will start. Okay, so basically, what is the culture of health? And a lot of this is from our friends at the American Heart Association. And basically, we want to make sure that everybody understands what's important for their health and what they can do to help prevent heart disease. So the reason heart disease is such an important factor is, unfortunately, some of its end products can either cause major morbidity or mortality, meaning people can be hospitalized, or if they have other infections, such as what's happening now with COVID, heart disease can come to the forefront and cause worse outcomes. In our nation, heart disease, and particularly in this area, heart disease is the number one killer, causing 40.6% of all deaths. Stroke follows nearby, and we'll touch on stroke a little bit today. Obviously, stroke is extremely important, and a lot of the disease that causes heart disease also leads to disease in the blood vessels that go to the brain also. So they often go hand in hand. And the way you prevent one prevents the other also. So an important thing is that a trend that we've seen, and obviously we compiled data a couple of years after the fact, but we started to see in this area and others that the rates of death from heart disease were actually increasing. And we would think that with improved technology and improved knowledge, that would actually be decreasing. For the last couple of years, it's been all confused with the COVID pandemic in the fact that a lot of the deaths are coming from COVID, but underlying a lot of those deaths are underlying heart disease and cerebrovascular disease. So in the Hudson Valley, in this area, you can see that heart disease is the number one cause of death and stroke is the number 5th. What are some of the reasons for that? And we'll touch on that a little bit later as we go through, but almost 43% of people in this area are overweight, and that encompasses obese also. It starts early. 17% of children are overweight, and for children who tend to gain weight less quickly, that is obviously way too high of a number. And obviously a lot of the patterns of eating and physical activity are set when we're children. So it's important, some of the principles that we instill in our children. The rates of smoking are a little higher in this area, and smoking is definitely an adverse risk factor for developing heart and cerebrovascular disease. Physical activity is an issue. A lot of us in the course of our life and staying busy, we're not able to be as physically active as possible, and that negatively contributes to heart disease. High blood pressure, high cholesterol, and diabetes all are significant contributors, which we'll touch on in a little bit. So this is just a little graph going up until 2017, and we have some more recent data. But like I said, the most recent data is a little skewed because of obviously the pandemic that we're living in. But the American Heart Association and cardiologists and people in general want to see that the rate of heart disease and stroke decrease over time. And you can see the black line is our target. We want to see as the years go by that it goes down. And it was for some period of time, but then we started to see an uptick in the rates of death from heart disease and stroke. And obviously we don't want to be going in that direction. What are some of the reasons for that? Well, obviously smoking rates have stayed relatively stable, although they're decreasing in other parts of the country and other parts of the world. But also negative eating habits, less physical activity as people do more activity online are negative contributors to this. 80% of the time, you can help prevent some of these effects. Obviously, genetics, as physicians, we know genetics plays an extremely important factor, but you can even change the course of your life in what genetics would have happen to you by just living healthier and eating healthier and staying healthier. And so we'll talk about some of that. But 80% of the time, you can actually prevent a lot of the risk of heart attack and stroke. So this is a little diagram about what actually happens. That is the heart. The major muscle that you see there is the left ventricle of the heart, where all the heart arteries supply. Most of the heart disease that we see is because of ischemic heart disease or developing plaque in our heart arteries. So if you can see at the top of the diagram, there's a smooth tube there. That's a normal artery. There's no yellowish plaque that's building up. You can see as time goes on, if we don't take care of ourselves and plaque builds up, you can see that the lumen, or the place in the middle of the artery where the blood flows through, it starts to be affected by plaque that's building there. With just beginning plaque or a small amount of plaque, we're actually at no increased danger. It's just a red sign to us that, we need to take a better care of our risk factors. You can see further down, we see significant atherosclerosis or a more bulky plaque. This is more worrisome for physicians when the plaque advances and is more bulky, not necessarily because it's blocking blood flow, but because of the risk of rupture. And so a rupture of a plaque is when that outer layer of that plaque that's in that artery actually cracks. There's a layer of calcium at the top. It can crack. And once it cracks and that fat is exposed to blood, a clot can form on top there. So what you see in the last diagram is a complete blockage. It's not all fat and it's not all plaque. Part of it is a small amount of it is a blood clot that has formed on top. And so what we typically see is that some type of stress causes that big bulky plaque to rupture and then cause a complete blockage, which would then cause a heart attack. Now, what are some of those things that can cause that plaque to rupture? In the winter months, the classic scenario is someone who's pushing themselves too hard outside shoveling snow. With that cold temperature and that fast heart rate, it can put enough stress on that plaque to rupture and cause a complete blockage. But other things like stress, emotional stress, or infection, like, for example, we see a greatly increase, almost 5 to 8 times risk of plaque rupture in people who have COVID infection. So even that type of a stress can cause some of that plaque to rupture and cause a complete blockage. This is what we're trying to prevent ultimately, is a heart attack or a complete blockage. And in terms of a heart attack, how does that ultimately cause someone to stop living? Well, the blood supply to the heart is then totally cut off. That will cause the heart muscle to be damaged and beat less vigorously. But that in the short term does not necessarily kill you. What does is that muscle, as it dies, it becomes very irritable and it can cause an abnormal heart rhythm. And that abnormal heart rhythm can ultimately stop the heart. Unfortunately, 25% of people do not survive their first heart attack. And what's the reason for that? Most of them, try to deal with it at home. They may not know that they're having a heart attack. They may attribute it to indigestion or, a musculoskeletal pain. And then ultimately they have an abnormal heart rhythm and unfortunately don't survive that. That's why if you're over the age of 40, definitely, and you're having chest discomfort, the safest thing to do is to come to the hospital and have someone look at an EKG, and if needed, have one of the heart experts come and see whether we need to do something. And there are potential things. Obviously, I'm an interventional cardiologist, and there are many of those. We can actually go in, put a wire through that blockage, and balloon open that blockage and put a stent to make sure that the blood flow is restored to the heart. But obviously, this talk is about preventing this so that you don't even need that procedure. But if it is needed, it's better to get it done and seek medical attention. So what can we do to help prevent this? How can we prevent heart disease? How can we feel stronger and healthier and have a better quality of life? So this is from the American Heart Association, but it targets, what they call the Life Simple 7, but basically 7 relatively simple things that we can do to help prevent heart disease and cerebrovascular disease. Number 1, stop smoking. Number 2, eat better. 3, get more active. Number 4 leads right into that, which is if you get more active, typically people lose weight. And then to control your blood pressure, cholesterol, and blood sugar. If you target these 7 things, your risk of heart disease is decreased by almost 80%. So the number 1 reversible thing that we can do is stop smoking. And I know it's not an easy thing. Cigarettes have nicotine in it, which is addictive. So it's extremely difficult to quit smoking. And really, the only proven thing to help people quit smoking is to completely quit cold turkey. Although some things like nicotine patches and nicotine replacement can help cut down, really quitting cold turkey is the best approach. Unfortunately, most people do that after they have a cardiac event or a stroke or something like that. But doing it before that can help prevent that. Quitting smoking has immediate health benefits. People's blood pressure can drop, heart rates drop, and we see the accumulation of plaque significantly drops immediately after quitting smoking. How can you eat healthier? Well, a lot of this we know, but it's better to reinforce. Fruits and vegetables are better. If you're going to eat carbohydrates, instead of breads and complex carbohydrates that are difficult for the heart, for the body to break down, like rice and breads and cakes and desserts like that, eating whole grains is much more healthy. Whole grain oatmeal and even whole grain breads if you want to eat carbohydrates. Low-fat products have less calories, which is the typical thing. Skinless poultry and fish are easily burned by the body. And so if you're going to eat meat, it's best to eat chicken, lean meats like pork and fish. Nuts and legumes are typically good snacks to eat rather than fatty snacks and things that are full of sugar. We'll touch on vegetable oils and non-tropical oils that you can eat, because people often have this question of what type of oil is best. You can eat red meat, but the leaner types of red meats are better. A simple cut of steak, and we'll talk about portion size, but that doesn't have as much marbling and fat in the middle, and cooking it a little longer can help dissolve some of that fat. The general idea, though, behind all of this is less calories are better. The less calories you eat and portion control, no matter what you eat, you're going to burn it. And if you add physical activity to that, you'll lose weight. And the more weight you lose, the slower your blood pressure will be and the lower your cholesterol will be. What are some of the things that we want to limit? is saturated fats, fatty fats, cold cuts, canned foods that have these saturated fats that are very difficult for the body to break down. Also, trans fats that are present in a lot of desserts and donuts and things like that, you want to really try to limit, primarily because the body it really struggles to break this food down. So as a result, we just store it as fat. And when you store it as fat, it gets converted to cholesterol, and you store it in your heart arteries and arteries going to the brain, which you really don't want to do. All right. So in terms of eating healthy, a lot of people complain that, even their families, that a lot of people complain that they don't like it. Now, there are different ways you can prepare your food. For example, this person's eating carrots and celery and spinach. Simply cooking them or caramelizing them on a grill will really help bring out some of the sugars that are natural inside these products and help them taste better. So you don't have to feel like you have to eat a raw salad. You can cook a lot of these vegetables and they will taste better. In terms of what you can do also in eating a healthier diet, cook more at home. The less people eat out and the less they know, and the more that they know what they're putting into their bodies by buying the raw products and cooking it at home, the more responsible they are about it. If you're going to go out and eat, now we have the internet. You can plan ahead and look at a menu and really sort of look at what the dish is and sort of prepare whether that's something healthy for you or not. When you cook for yourself, shop wisely. A lot of the products now in supermarkets have nutrition facts on that. And you should look at how many calories there are. Generally speaking, if someone's trying to limit their calorie intake, you should eat about 1,800 calories a day. In this day and age, that can really be calculated by just looking at what you're eating and what you're buying every day. Now, often people will eat a piece of meat or a steak like this. Now, obviously, a lot of people like steak, and we're not necessarily, as opposed to years ago, we've realized that eating some red meat is okay. It's really, like I said, about calorie intake and portion control. Often people who just eat just meats, they burn it even quicker. We've realized over the years that carbohydrates and complex carbohydrates are really some of the adverse risk factors for developing high cholesterol, high blood pressure, and diabetes. So generally, meat products are fine, but portion control is very important. Contrary to what most people believe, a 12-ounce piece of steak is actually 4 servings. Now, not to say that you're just going to eat, 3 or 4 ounces of steak. Having 2 servings is fine. If you're trying to lose weight, eating a full 12 ounces and 4 servings is really probably against what you should be doing. If you're trying to maintain your weight, 2 to 3 servings of this is fine. So it's really what your goal is and what the end goal is. All right, so I mentioned a little bit of the interactive time. So often we get questions about specific types of foods. So wine is a typical thing that we have questions about. So aside from wine, but general alcohol, there has never been a study that have proven by randomized, meaning a real study that has put people drinking alcohol versus people who are not, head to head. There's never been proven that any type of alcohol is actually beneficial for the heart. If we are going to recommend any type of alcohol, it would be red wine, but limiting it to 1 to 2 glasses maximum per day. So generally speaking, cardiologists do not recommend alcohol intake, particularly beer and hard alcohol. You can have it in moderation, 1 time a week or 1 time every couple of weeks. But on a daily basis, you should really limit your alcohol intake because it really gets stored as complex carbohydrates and it's difficult for the heart and the body to burn. If you are going to have alcohol, red wine is preferred just because of its antioxidant properties. So these are pumpkin seeds, but also there are various other types of seeds also that are generally actually beneficial. So if you're looking for a snack, Obviously, vegetable snacks are the best, followed closely by fruit snacks, meaning actually dicing and eating fruit, which if you get fresh fruit, if you're lucky enough to get it on a relatively regular basis, is some of the best snacks that you can have during the day. But something like pumpkin seeds is actually a very good snack and is easily burned by the body. So that should be, these are cranberries. If we had to recommend any type of berry to eat as a snack every day to sort of tie you in between breakfast and lunch or lunch and dinner, cranberries are probably the most beneficial. They have easily burned starches in there, and they have many antioxidant qualities that are good for the heart and helpful in breaking down cholesterol. What about coffee? We've heard in the past that coffee can be detrimental to the heart. The truth is, in specific heart issues like atrial fibrillation, which is an abnormal heart rhythm, drinking too much caffeine or intaking too much caffeine can cause your heart rate to rise a little bit. So in specific conditions like atrial fibrillation, you may want to talk to your cardiologist about your caffeine intake. But in all other conditions, if you have a normal heart rhythm, coffee is actually beneficial. It often wakes people up and prevents you from sleeping. So that's a good thing rather than sleeping during the day. It also increases metabolism in some people. Frequently, if people drink coffee, it's been shown that they actually eat less things because it's a little bit of an appetite suppressant. So we recommend drinking coffee in moderation. You shouldn't be drinking 8 glasses a day, but 1 to 2 glasses of coffee a day is actually beneficial. All right, now what about exercise? What is the general recommendation about exercise? Exercise is obviously good. And how much exercise? Well, generally speaking, if you're doing moderate exercise, which is brisk walking and many of the things that most of us can do, we recommend 150 minutes a week. Now, it sounds like a lot, but if you break that into multiple times a day, then you can do about 25 minutes a day, 5 times a week, and you can break that into shorter exercise. If you work in a building, try to take the stairs. That simple going up the stairs multiple times a day can probably add 15 to 20 minutes of exercise for your day. A lot of people have invested in Fitbits and Apple Watches. A lot of these products are make it possible for you to track your steps. I've seen that patients who really start tracking what they're doing in a day actually do more physical activity, and they want to see a higher number. So a simple thing like a Fitbit is a great present to get your loved one or for yourself that really allows yourself to push yourself and do more and more physical activity a day. If you're someone who can run and do vigorous activity, then you can cut down your amount of exercise. Only 75 minutes of vigorous exercise a week will be enough to burn enough calories that if you're eating responsibly, you will probably be losing weight or at least maintaining your weight. So the general take home is you should exercise as much as possible, but break it down during the day into smaller exercise routines that you can do that will get your numbers up there. If it's possible, save up for a Fitbit to help track the amount of exercise that you're doing. Now, oil is extremely important. A lot of us cook with oil. What do we recommend in terms of oil? This is a frequent question that we get. We'll talk about it a little bit later in some of the question and answer, but some of the saturated fats and oils that we use and vegetable oils are actually not the best. Olive oil is probably the easiest broken down oil that you can drink. There have been crazes of different types of vegetable oils and coconut oil, which we'll touch on a little bit later. It's actually been shown that it's difficult for the body to break most of these vegetable type oils and even nut oils down. Olive oil has stood the test of time to actually be the most easily broken down oil. If you can, get a spray. a spray oil because you will use a lot less oil in cooking your food. All right. Now, what are the most important things to cardiologists and doctors when you see them? I would say right behind smoking, the number 2 effect on people in developing plaque and heart attacks is the blood pressure. And a lot of us are, one of the most frequent complaints that we get is fear of side effects of medication. And we understand that. Obviously, people who have high blood pressure, sometimes they feel more sluggish when we bring their blood pressure down to a more normal number. But the bottom line is high blood pressure damages heart vessels, and plaque that's there will get worse if your blood pressure is very high. Also, it causes kidney issues over time, and it causes strokes and bleeds in the brain. So we really have to be cognizant of the blood pressure. So what's the difference in the different types of blood pressure? The top number is your systolic blood pressure, which means that the force with which your heart pumps out blood vessels. And this is affected by how stiff your arteries are. Generally, as we get older, unfortunately, arteries stiffen. And if you picture an artery that stiffens and becomes less elastic, the pressure inside is going to go up. So most people develop a higher blood pressure as we get older just because these arteries stiffen. What's some of the causes of stiffening? Obviously, age is a major contributor, but diabetes and smoking stiffens arteries and causes blood pressure to go high. The bottom number typically, and this is not a hard and fast rule, but the bottom number is more of a problem in our younger years. If we were to look at high blood pressure in younger people, younger than 40 years old, typically their bottom number is significantly elevated. And this is the force with which the heart fills with blood. And so it's a different phase of the heart cycle called the diastolic phase. And so which one is more important? They're both important. We don't want either of these numbers to be high. It's been shown that the risk of heart attack and stroke is high, whether either your top number or your bottom number is higher than it should be. So what is considered a normal blood pressure? 120, some people will see the JNC, which is one of our guideline organizations, say that 120/70, American Heart points to 120/80. Generally speaking, 120/80 is an acceptable and normal blood pressure. Believe it or not, once your numbers go higher than 120, we consider it elevated blood pressure. Stage 1 high blood pressure starts at about 130, or from the bottom number being 80 to 89. So a lot of people will view their blood pressure as normal if it's, for example, 136/86. This is actually stage 1, approaching stage 1 hypertension or pre-hypertension. A lot of us will not treat a blood pressure like this unless someone has significant risk factors. We'll often advise just lifestyle changes. But, we start to see that the beginning of plaque as soon as the blood pressure goes above 130. So that really, if you see your numbers starting to creep up, you should really discuss it with your physician in terms of what are some of the things you can do to help bring it down. Once you start getting above 140 and 90 for the bottom number, that's when generally we start treatment. And treatment is with blood pressure medications. If we can try to avoid the blood pressure medications and have you control it just with eating healthier and exercising, then everybody prefers that. Once your blood pressure starts going above 180/120, that's when we have to really get serious about starting you on multiple blood pressure regimens and really doing some added heart testing to see if something else is contributing to your high blood pressure. Obviously, if your blood pressure starts going above 200, that's the time at which we really worry about the short risk of stroke and things like that. And often you should be going to an urgent care or to an emergency room if your blood pressures are above 200 or 110 is the bottom number. So often the danger of high blood pressure is people think that they're doing great, they feel fine, and they don't realize that their blood pressure is going up. And so sometimes at-home blood pressure cuffs are very useful in seeing, especially if you have a family history of high blood pressure or if you're overweight, to really see if your blood pressure is going high. I recommend for all my patients, and sometimes insurances approve this and we can give a script, that anybody who has underlying heart conditions should manage and see what their blood pressure is at home. And an at-home blood pressure monitor is a great way to do that. Obviously, taking your blood pressure, 10, 15 times a day is probably going to drive yourself crazy. So doing this in when it's important, probably a couple of times a week is probably the best. So what are the major problems with blood pressure? Like we talked about, stroke, vision changes. It's been shown, and if those of us who go to eye doctors, if your blood pressure is high, eye doctors can really see that in just looking in your eye, because it causes a lot of these little blood vessels in the eye and in the brain to sort of rupture and break up. And we can see that when we look deeper. In generally how you feel, you may not feel any different, but a lot of these things will affect the heart, kidneys, and will cause erectile dysfunction and general sexual dysfunction, which we don't want to deal with. So controlling and monitoring your blood pressure is extremely important. All right, so high blood pressure, high cholesterol, diabetes can cause heart attacks, and we touched on what a heart attack is and how it can happen. What are some of the symptoms that we should be aware of to know that we may be at a point where we should seek medical attention sooner rather than later? In men, they tend to have the typical symptoms that everybody knows: pain in the chest, it radiating to the shoulder or to the neck, shortness of breath and sweating. Unfortunately, women tend to have less typical symptoms. Often, and I can say that when I take heart attack call and I get called by the emergency room for patients who are having heart attacks, in women, often we only see GI symptoms, meaning indigestion and burping and things like that, and they attribute it to GI symptoms. So often, unfortunately, women come for attention to treat their heart attack much later than men do. Men may come in the first 15 to 20 minutes because they really feel the typical symptoms, whereas women may come a full 24 hours or more later once they're starting to experience shortness of breath or some of the later signs of having a heart attack. So it's good for women to stay on top of their risk factors because they don't have the typical symptoms of a heart attack. What about stroke? What are some of the things you should look out for? Generally, this is an acronym: FAST: facial numbness, weakness, or drooping, and often family members are the first people to notice this, or not being able to move a certain extremity like the arm or the leg on one side of the body. Typically, strokes affect one side of the body, so people will notice that both their left arm and left leg or one side of the face is drooping. If you're having difficulty speaking or slurring of words, it's best to call 911 right away and seek medical attention, because we can really treat strokes with strong blood thinners right away. Whereas if you stay home, the damage becomes more permanent. So really recognize these symptoms, or if someone else or a loved one recognizes these symptoms for you, seeking urgent medical attention is extremely important. All right, one of the more difficult things to treat and prevent is stress. Obviously, with the pandemic going on and working and children staying at home, stress levels are probably higher than they have been in a long time. And as a result, we're seeing higher blood pressure, more cardiac events happening. So really limiting stress is extremely important, but obviously is difficult in the modern era. These are some general things that we can do to reduce stress. And like I said, it's not always easy, but simple meditation or taking time to just close the lights, limit the outside stress, and closing your eyes and just trying to limit what's going on in the outside world and taking deep breaths is a very good tool in getting your blood pressure and everything to go down. So sometimes doing this 2 to 3 times a day is useful. Like I said, meditation or prayer. Often, if you're feeling stressed out, physical activity and going for a simple walk outside is a great way to get the heart to relax and take your mind off of the stress. If you're having a lot of personal issues, for example, speaking to your physicians and trying to really concentrate on yourself is the key thing here. Generally speaking, we see that stress levels are lowest in people who exercise more. So getting regular exercise and sleep will really help reduce your stress levels. All right, some more issues. Is it heart healthy? So we touched on this a little bit later, but oil is a frequent question that we get questioned on. And a couple of years ago, coconut oil was a big sort of a fad in people thinking that it was better and better for the body and better for the heart. Time has proven that a lot of these specialty oils are not easier for the body to break down and are not beneficial. In terms of fats, what types of fats are good or not? We need a certain amount of fat in the day. If someone were to eat totally non-fat diet, actually we see some adverse health events with that. So we want you to eat a balanced diet. And sometimes that's why we see some people who eat purely meat and limit all their carbs actually do fine because they're limited their calorie intake. And it's sometimes easier for the body to burn fat. But it depends on what types of fats. Saturated fats in products that are packaged are difficult for the body to break down, whereas natural unsaturated fats and omega fatty acids present in fish, and we see a nice piece of salmon there, is easier for the heart and the body to break down. Certain types of lean steaks also have unsaturated fats, which the body can break down. And like we talked about, portion control is extremely important. So some are healthy. Now we have a question about e-cigarettes and vaping all the time. And the bottom line is we don't really know how beneficial or negative they are. They're beneficial for sure if they cause you to really cut down on smoking. But there have been recent studies that have showed higher rates of certain events like stroke and heart attack with vaping. So being familiar with exactly what you're putting in your body is extremely important. E-cigarettes and vaping are still under investigation and under studies that are ongoing. So we are researching that. Now, just touching on sleep, we've mentioned it before, but one thing is for sure, getting less than 5 hours of sleep a day has shown that blood pressure and breaking down of calories is much slower. So blood pressure rises and people tend to gain weight with less sleep. What do we recommend? Between 7 and 9 hours a day, if you're able to do that. So I know it's not always the easiest in our busy lifestyles, but the time that you're able to set aside for sleeping at regular intervals and limiting the amount of outside stressors, like having the television on and just dedicating time to sleeping, you'll see that you actually burn calories easier and you're much more refreshed the next day. So regular sleep, of course, is healthy. So a quick question, which one is healthier in these two things? Clearly what we're showing here is vegetables that are raw and look like they're pretty fresh compared to frozen vegetables. And this is often a question that we get. People are not able to go to the supermarket and get fresh vegetables every day, and they tend to be more pricey, whereas the cheaper things are frozen. They're actually both beneficial, and we recommend that if you're able to get frozen vegetables and that's the easiest thing for you to cook, that is fine, and it saves a lot of the vitamins that you're supposed to get, and they're easily burned. So both have the same types of vitamins and minerals. Just touching on oral hygiene, in terms of, a lot of patients come to us and ask us about antibiotics when they have heart conditions, when they're going for dentistry work, but often only people who have had valve replacements actually need antibiotics. But Having good gum health and taking care of your teeth is actually been proven to help reduce the amount of heart disease you've had. We've seen people have lower blood pressure and better heart conditions when they have better gum care and actually less gum disease. A lot of this happens to be that people who take care of their teeth tend to take care of their health overall. So there's some things that go hand in hand, but taking care of your teeth is actually extremely important. So that is heart healthy. A word about how you eat your food. Now, if you're the more time that you take to eat your food, if you have that luxury, the actual more full you feel and the less people eat. So actually eating your food really quickly, although some of us have to do it because our work schedules are kind of busy, eating your food more quickly is actually, it's been proven to actually you eat more. If you eat quickly, you're still hungry, and you tend to eat more. So we recommend trying to take your time in eating your meals if you have that luxury. A word about gluten and complex carbohydrates. A lot of people have unknown gluten allergies that they don't know about, which is why a lot of people who have chronic irritable bowel syndrome, they feel better on low gluten diets because basically their body struggles to break it down. We recommend whole grain foods. If you're going to eat bread and you're going to eat rice, look for whole grain foods. That will, because it's much easier for the body to break down. It causes less triglycerides to go up and is much more easy for the body to burn. So whole grain is heart healthy. In terms of salt, another question we typically get, what's the best type of salt? A lot of people will say some of these bigger Himalayan salt or sea salt. Is it better? It is better in certain cases just because people tend to eat less salt when the grains are bigger. But generally speaking, if you measure it out and weigh it, it doesn't matter what type of salt you use, whether it's table salt, kosher salt, sea salt, they're all equally negative in terms of how much blood pressure elevation you're going to have. Again, salt, as we see in the winter, holds on to fluid. So if you eat a ton of salt, you're going to notice you hold on to a lot more fluid. You're going to feel more bloated and swollen. And as a result, it's going to stretch your blood vessels out and your blood pressure is going to go up. So really try to limit your salt. How can you count it? Well, sodium is in salt. So really try to limit your sodium intake to 1,500 a day. And so you can count that if you really look at the packages and what you're putting in your body. But generally speaking, limit salt as much as possible. And the type of salt you use really doesn't matter. Okay, so really setting a good example for your family and for your children. A lot of our eating habits start when we're young. So grandchildren, children, really try to instill in them what's the healthier way to eat. We are trying to get you to prevent heart disease and cerebrovascular disease before it happens. And the only way you can do that is by eating healthier, staying more active, and making sure that your high blood pressure, high cholesterol, and diabetes are controlled. So that's the simple 7 that we talked about. If you really concentrate on these 7 risk factors, you will notice that you delay the onset of heart disease significantly. So that's the end of it. Pretty basic, and a lot of this stuff we may know, but it's helpful to be reinforced. I have seen many of my patients, if they really start to concentrate on their weight and dropping weight and limiting their calorie intake, we've seen them reduce their medications in half. And often I see that in my patients who have had heart attacks and have stents, if they limit their risk factors, they really limit the amount of repeat procedures and things that they need. But if you do have some of these symptoms, we're here to take care of you and see if there's problems.